I grew up to study medicine because I experienced of caring for a grandpa with a brain disorder. And my adopted mom passed away after suffering a stroke. Stroke happens when a part of the brain dies due to disruption of the blood flow to the brain. Every 2 seconds, someone in the world suffers stroke, and each 4 minutes, someone dies from stroke. For many sufferers, this disease might cause permanent disability. So I started my research into stroke because I want to help those with stroke recover to their maximum potential. What are the differences in stroke between men and women? You may think that women are protected from stroke. 1 in 5 women had a stroke at some point in her life, and no one is immune to stroke. This could affect your mom, your wife, and even yourself. There is some evidence that women suffer worse outcome of the stroke compared to men, such as death and severe disability, like the picture shows. But we still don't know why women have less recovery. Is it due to differences in patients' characteristics like age, pre-stroke health, or any gender bias in stroke care? So my PhD research will address this question. I use the data from high-quality studies around the world and from a national stroke registry, including 30,000 stroke cases. So far, I have found that women, compared to men, were 30% more likely to die, 30% more likely to be disabled, and have poorer quality of life, consistently across regions and time period. Based on these findings, I can suggest some strategies to reduce the sex disparity in stroke outcome. It is important to manage stroke risk factors well in the elderly and ensure access to evidence-based care, particularly treatment with aspirin. My thesis is unraveling the differences between men and women in stroke. It is my hope and my goal to make this scale balance, bring smiles to millions of people worldwide who suffer this devastating stroke. Thank you.